So this is really different from what was initially thought about when people were designing the app. And it's something that's called a decentralized approach. So what that means is that all of the information that you provide the app remains on the user's device in the phone. So the only person that has access to that information is the user itself. And you also have the ability to then, manage that data. So in terms of deleting it or store, or for how long you keep it within the app on your phone. I'm just going to share another video whilst I talk, and it's just a little bit more of a, if you haven't downloaded the app, it gives you an opportunity to see what the app looks like. So let me just bring up share screen. Holly, sorry, I'm going to ask you there if you can see this again.
I can. All good, Hermina.
Awesome. Okay. So the first thing is when you download the app, which is available in the Google Play Store and the Apple iStore. I think I just saw a question there about compatible devices. So of course, the app is available on all Apple devices over iPhone 7 and upwards, which is iOS 13. And it is available on all Android devices over the operating system of Marshmallow 6. And obviously there was a lot of conversation about this in the news around, what about people that are using iPhone 6 and why was this not thought about? This was absolutely thought about, but unfortunately one of the dependencies of using Google and Apple's technology, which is made on the use of Bluetooth, is actually only available in their latest version of the operating system, and hence why it's not available in earlier devices. When you download the app, you'll be shown this introductory screen, and this sort of sets the scene on the various different features of the app. So the ability to get notified, and that's kind of the core, premise behind the app, the idea of digital contact tracing. And I want to sort of touch on this in a little bit more detail, which explains sort of that algorithm and how the algorithm works. So I think there's a lot of myths around whether or not the app is, will it tell you incorrectly? Will it notify you incorrectly? And all of those things. So we're actually really confident on the science behind the algorithm, in that what it will do is that it will only notify you if you've been within the range of someone that is tested positive for coronavirus within a 2 meters radius for more than 15 minutes. And actually that algorithm is something that we have strengthened over time. And in our latest release that went out a few weeks ago, we've actually made the algorithm even stronger so that it will pick within that 2 meter radius only, and as long as you've been within the time frame of 15 minutes. The other thing that is important for me to sort of touch on is how does the actual alert system work? So I'm going to use a very, very simple kind of way of explaining it, partly because I'm not very good with the technical element. But the idea is that if you and I, so I'll take Laura, for example, me and Laura are sitting in a coffee shop, and both Laura and I are sitting within 2 meters for a few hours. We're sitting there for 4 hours, say, for example. And both of our devices have the app downloaded. What happens is that during this time, my app is generating something called anonymous IDs. And these keys are being essentially, my phone is essentially flirting with Laura's phone, and they are both sharing these anonymous keys with each other. And in the phone's memory, it's creating a log of being near this particular anonymous key for 15 minutes. Every 15 minutes, those anonymous keys change. So it's, again, to ensure that there's no way of tracking it back to a particular person or a particular device. But all of that information then remains in the memory of my phone. After those 4 hours, I go home and I feel like I have some symptoms of coronavirus. So I use the symptom checker within the app. It then asks me to book a test. I then book a test and I get my result back, and unfortunately I've tested positive. At that point, I'm asked to share, if I would like to share that information anonymously with all of those different keys that I may have been around in that duration of time. At that point, my phone will then send an alert to all of those anonymous keys that it's been near, that someone that they've been near has tested positive for coronavirus, and therefore they should consider getting a test. And that's the basic nutshell of how the algorithm works. I'm just going to take you to this screen, and this is sort of going back to that privacy element. So once you're setting up the app in your phone, the real emphasis here is made on that protecting your privacy element. So really core important things that you can see on this particular screen is, number one, the control remains in the person's hands. So any information is stored on the phone, not in a central database, and you have the ability to control that data. So the app stores your data for 14 days, and after it's been recorded, and that's for those anonymous keys, and then 21 days for any venues you check into using the QR code functionality. But at any point, you are able to delete all your data by choosing delete all my data, or by completely deleting the app. So if you delete the app, all of your data will be deleted at the same time. I'm just gonna then move on to our first bit of information. So really importantly, what is that personal information that you're providing the app? So actually there's only two pieces of information the app actually takes from you. One is this first element of your postcode, which is the postcode district, and this covers on average 5,000 to 8,000 households, so it's quite a big area. Again, to sort of ensure that it can't be linked back to even one street or one house, but it still gives you enough of a breadth to understand the local risk of your postcode area. So once you've entered that, you'll be able to see. I'll let the camera just stay out there. I'll just take you to the home screen of the app. So once you've added that postcode and you've set up your app, you'll see that that area risk level is shown here. So actually it's a really important function, because now with all the tier information, what you'll be able to see is a very quick way of seeing what that local tier risk level is and what kind of things are permissible and what are not permissible with the information that local area risk level provides. Finally, just on the last point, because I'm really conscious I'd like to take questions, I'll just take you to the element where you can delete your data, which I think is really, really significant. So if you click on the home screen of the app, there is a button that says About this app. When you scroll down there, you'll see this segment here which says Manage my data. And this is where you can actually see all of the information that you've provided the app. Now that includes the postcode district that you provided it. If you have put in symptoms, it will have your symptoms onset date. So when the date that you have put in the symptom checker. And then finally, you have the list of all of the different venues that you've checked into. Now, at any point, you are able to click delete all my data and delete all of this, or you're able to delete a segment. So for example, if there's a particular venue that you want to delete, or there's a venue that you accidentally checked into that you didn't actually go to, you're able to delete. So again, all of that control remains in the user's hand. So I'm going to just stop sharing my screen at this point, and I just want to see if there's any questions.
Hey, Amina. I've answered a few of the questions there in the chat already. I don't know if people have additional ones to add. I know Fiona has brought up an interesting point about the QR codes. It's just the last question there. I don't know if you can read that one. For some reason, my chat has disappeared. So Fiona's was, if I go swimming at the gym and spend an hour there and leave to go home, where I don't check in, the app thinks I'm at the gym from 9 AM to midnight.
So that's a really good question. Yes, at the moment, there is no feature for you to check out of a venue. So once you check in, you know, it's not that it believes that you've checked in for that time, but it will just know that that's the timing that you've checked in at is important. I think the other thing is that when that information is used, for example, when you get a venue alert, so when you receive an anonymous venue alert, it will indicate to you when that alert is coming from. So it's for the user to make the judgment whether or not they were at the venue at the time of when the venue alert has been processed. So it's not that it will think that, okay, you know, for example, if you've gone swimming for an hour and then you've left, If in that hour nobody has had a tested positive or etc., then really you're not in scope. But actually it doesn't really generate its venue alert based on that. It bases it on a lot more than one positive test case for a venue to be given an alert.
Can I just add to that as well, Amina, on that
Yeah,
particular
sure.
one? Hi everyone, I'm part of Amina's team. So that decision about whether or not you you get an alert, it's not just an automated thing. So there's a human step in that process to make that judgment as well, and it will always be based on whether or not you were in proximity as well to somebody who was there. So when that decision is made about when you're actually getting those alerts, all of that is factored in. The reason why the checkout functionality was not put into the app is, of course, when we did the user testing and so on before it was developed, through the research, we found that actually a lot of people just wouldn't check out. It would be almost too cumbersome to ask them to check out as well as check in. And so that's why it's created in a way whereby you don't need to check out. However, that does not mean that you're then automatically going to get like lots and lots of unnecessary alerts. That's factored into the process, and that wouldn't happen.
That's really useful. Thank you very much. Does anybody have any further questions? If you do, just pop them in the chat. And if not, we'll move on to Dr. Justin Varney.
Mm-hmm.
That was really, really interesting. Thank you very much, NHS England. Yeah, I learned a couple of things myself there, so that's really good.
No worries. Thanks very much, Holly.
That's fine. I don't think we have any further questions.
Holly, I think there was a question which someone had raised, if I just scroll back up slightly. I think it was to do with exposure notifications. And I think somebody gave an example of someone who had like a university student who perhaps like felt that they didn't get the contact tracing alert notification, and then when they opened their app they realized that they had to self-isolate, but it was perhaps for a shorter period than what they had anticipated. In that particular scenario, so what happens is individuals will need to, we have heard of that happening before, and often what the problem is there is that an individual hasn't turned on their exposure notification settings on their actual phone. So when you set up the app, it will ask you permissions, but then if on your phone generally for all your apps you've just said I don't want it to pop up on notifications, then that could be the reason there. So there are some instances where because of those settings an individual doesn't have the notifications turned on, and we do have FAQs on that particular subject. So I will post that into the chat. Sorry, I can't recall who posted the question. I'll pop the FAQ related to that into the chat so that you can see all of the details and all of the steps on how somebody would then turn the notifications back on.
Thanks, Anne. Holly, I'm really sorry. I know you want to go into Justin there, but it's just a question there from Dan, and I don't want
that's
to feel
fine.
like we've not responded. Dan, great question. So those who do not have access to the internet, we have tried to work with mobile operators to zero rate any data used related to the app. So if you do have limited data on your phone to use the app, it will not be charged for you. So that's something that we have done. If people do not have access to any internet, then that is obviously a problem, because the app does only need very little internet access in order to do that upload of those anonymous keys. But it is something that is a requirement, but we have tried our best to try and mitigate against, at least with those who have limited internet access. I think your question overall on access in general, so for those who can't use the app, either because of an accessible smartphone, either because of not necessarily being digitally literate, all of those things for us is important. But it is also important for us to note that the app is just one element of the fight against coronavirus that the NHS Test and Trace programme puts in place. So all of the manual contact tracing, manual testing, and actually all of the features that the app has is obviously still available via the non-digital routes. So we would hope that people continue to use the wider Test and Trace programme. I hope that answers your question.
No, that's great. Thank you very much, Amina, Anne and Laura. We will now move on to Dr. Justin Varney. Hi, Justin.
Hi, Holly May. Okay, so let me turn on my camera as well so then people can see me. So hi, everyone. I'm sure you'll understand it's been a pretty back-to-back day as the new tiers have been announced. So I'm going to talk a little bit about where we are in terms of case numbers. I'll then talk a little bit about the new forms of testing, and then I'll talk a little bit about vaccination as well. And if you put questions in the chat as we go, I'll try and pick them up. So what we've started to see is the first signs that the last couple of weeks have been bringing down case numbers across the city. The reason we've gone into tier 3 is that that rate of descent isn't really sustained yet. We've only got the first couple of days of coming down. So we really need to get a good kind of solid 10 days. That's also why areas like Liverpool have gone into tier 2, because when you look at their numbers, they've been coming down for quite a long time, actually. So they're on a really sustained downward trend. So that's kind of why we've ended up where we are. Government's looking at 3 different sets of data when it's deciding on tiers. So first of all, it's the overall case rate of all ages. Then it's the case rate in the over 60s. And then it's also looking at the pattern of the spread, and it's looking at the pressure that's created on the NHS. So how many patients are going into hospital, how many spare beds are there in the system. So what we're seeing at the moment in Birmingham is our case rates for all ages is starting to come down, but our case rates in over 60s is just starting to flatten. So we haven't seen the downward bit yet that makes us confident that things are heading in the right direction. And our hospitalizations is also pretty flat. So what we tend to see is case rates in the community rise. About 2 weeks later, they rise in the over 60s. And then a week or two after that, you start to see the hospital admissions rise. And it's the same that happens when you're coming down. There's a bit of a time lag. So, you know, that's why we're staying in going into tier 3 next week, is because we do need to see more of that coming down. We need to take the pressure off the NHS to ensure that we've got enough beds for all the things that normally go wrong at winter. So in an average winter, even if you ignore flu, we slip on the ice, so we break bones. The cold weather means we're more likely to have heart attacks and problems with our chest, our respiratory system. So all of those things put a lot more pressure on the NHS in the winter. And at the moment, what's happening is COVID is taking all of the spare capacity in the hospital and sucking it up. And that means that the NHS is really struggling to deliver normal services. And we're starting to see things like elective treatments being cancelled. So planned hip operations, for example. So that's why we need more restrictions for a bit longer. It's also about giving us more of a buffer space for those 5 days over Christmas. So we are going to get a bit of freedom for 5 days over Christmas to form a bubble. You have to choose which 2 households you're going to bubble with. You can't switch them during the week. So I'm afraid if you don't like your relatives on Christmas Eve, you're stuck with them until that bubble ends. And I would say, really do think carefully. You know, none of us want this to be the last Christmas for someone we care about. So you are going to have to make, each of us will have to make some quite difficult decisions about whether it's worth the risk and whether we trade off not having Christmas with our elderly parents this year in order to make sure that we've got it next year or the year after. And that's going to be your own individual decisions, but it is the reality of where we're at. So there's plenty of stuff, and I think we've sent round the guidance on the tiers. We've tried to turn them into a graphic as well to make it easier to help as well from that point of view moving forward. So, you know, and it is going to be key what we can all do to abide by this. It's worth having a look at the local outbreak engagement board that was this afternoon. The police and our enforcement team did a really good presentation on actually how they're working together. They're being really firm. So their kind of line is, you know, people now understand the restrictions. So you can't kind of stand there in the middle of a house party and go, oh, I didn't know, cop. You know, and that's why they've gradually got firmer and firmer, because it's fair enough. a month or two ago, people were still learning. Now there's no excuse. So they're much stronger. Sorry, forgive
Bless
me.
you.
Thank you. They're much stronger on enforcement now, and you can see that in terms of the figures. What's also interesting is that the police also presented their analysis. So they're also looking at, are there any differentials in terms of the number of people involved, the types of events and all of that. So it's really worth looking at that. So I'll move on to talk about testing and where we are in terms of testing at the moment. So there are basically 3 types of tests at the moment. So there's the antibody test, and frankly, I would say don't waste your money. You can only get that if you're part of a research trial or you pay for it privately. It's about 100 to 190 quid. And we know that from the National React survey, where they are doing this big research study into antibodies, that people seem to forget how to make the antibodies after a while. So over the whole country, where about a month ago, 6.5% of the population in the sample had antibodies, now it's fallen to 4.4%. And we particularly see those antibodies dropping down in the older, most vulnerable populations. So don't waste your time on that. So the 2 types of tests, PCR. So PCR test, swab to the back of your nose, back of your throat, goes into the little test tube, gets sent to the lab. You get a result within about 24 hours. PCR is very good at telling you, have you got COVID? What it's not great at telling you is how infectious you are. So PCR is really good at detecting it in the first couple of days of infection when you only got little amounts of virus in the back of your nose or your throat. And it's very good detecting it when you've had it for a while as well. So it's the best test for saying, have you got COVID or not? The new test, lateral flow, is still the swab at your back of your nose, back of your throat. But then you give that swab to a technician. The technician mixes it with some liquid. They drop that liquid onto a little test kit that looks a bit like a pregnancy test. And they read that after about 30 minutes. And you get your result texted through to you through the app. And that's very good at telling you, are you infectious or not? Because for that test to work, because it hasn't got lots of fancy machines, it's got to find a lot of virus on the swab that goes in the back of your nose or the back of your throat. So the lateral flow is very good at saying, are you infectious today or not? But it's not very good if you're in the early stages of infection, or it just happens to be a day when you haven't got a lot of virus in the back of your throat and your note. So that's why lateral flow is really about testing people to enable them to do things. And it's why there is national work going on to roll that out, for example, in care home visiting, because it will make a big difference. You know, people will be able to book to go and visit someone in a care home. They'll get tested there and then. And if they're not infectious, it means that they can have a much more normal visit. So that's the kind of thing that it's being used for. Where it's not as effective is where we're trying to control the spread of the virus, or if someone's symptomatic, we really want to use the PCR to make sure it is COVID and not something else. So that's why there's difference in the 2 types. The PCR test is the only one that's available really at the moment. The lateral flow, we're working on it. And I would expect us to open some testing sites over the next couple of weeks. But it won't be a free-for-all, and it won't be everyone will be able to get it, because there's a lot of work to set that up and get that moving. So that's where we are in testing. Finally, before I go into some of the questions that I can see piling up there, Holly, is vaccination. So we're still seeing the processes work through. About 4 or 5 of the vaccines are now in that final stage of going through regulation. They all are slightly different. They work in slightly different ways. There's also quite a lot of difference between them about how they have to be stored and whether they need to be kept in a super freezer or not. And so that makes quite a big difference about how they can be used. So we think that the Pfizer one's likely to come out first. That's the one that has to be in -75, and you can only move it like twice, and there are lots of limitations. So that may well be used first for NHS staff working in hospitals. We know that the Oxford vaccine, which is a bit more robust and can go in a normal fridge and is a bit more like the flu vaccine, is pretty close behind, and we would expect to see that rolling out in January. And then that'll probably be used in the over 85s and care homes. And then we'll see it rolling out. But there is a national committee that decides what the order is that people get the vaccine. And the regulator sets out who can have the vaccine. So if one of the vaccines, for example, is very effective in older people, then the regulator will say, this is how it has to be used. So that's the process it's going through. It will take several months to vaccinate the most vulnerable, because you've got to have 2 doses. And that's where, until that plays out, we're going to live in this world of restrictions, I'm afraid, for quite a lot longer. So I'll try and pick up some of the questions for the chat, Holly May, and if there's anything you want to pull out particularly.
Do you want me to read them out to you, Justin? That's no problem.
I think I'll pick some of them out, and then if just scan if I miss anything.
Will do.
So just finishing off on the vaccine point, because there's a question there from Darius. So the vaccine's preventable. It's not a cure. So vaccines are around prevention, not around treatment. So what the vaccine does is it makes your body learn how to make antibodies and protect itself, so that if you're exposed to the virus, you basically fight it off. So we don't use vaccines to treat people. One of the things we don't know yet is if we've given you the vaccine and you've learned how to make these antibodies, does that mean that if someone coughs on you with the virus and it lands on your hands, do you get a response that basically kills it when it lands and that stops you passing it on? We don't know that yet. That's one of the things that people are looking at. But we do know it makes you mount a defense so you don't become infected, which is really good. There's a question from Ali about, if you don't have symptoms, can you get a test before Christmas? Not at the moment, Ali. We're working really hard on what can we do around lateral flow and standing that up. It was the technology that part of what was used in Liverpool. Liverpool had kind of 20,000 soldiers deployed to help them do it. And unfortunately, that isn't what's being offered across the country. So the council's having to redeploy staff to step up testing centres. And there's not, we haven't got loads of staff to be able to do that without compromising other services like the bins or care homes. We just can't do all of these things at once. But I am conscious about that. And if we can find ways, then we will. But I think at the moment, it's unlikely that there will be an opportunity to test before you go and visit friends and family over Christmas, I'm afraid, just because of the sheer capacity to this. So Adrian asked about timeframe the results of the COVID test. I assume this, Adrian, is asking about the lateral flow or the PCRs. So we don't manage as the council or the public health team the result process. So what happens on the PCR sites is they're run by the Department of Health. Those samples go off to the lab. Then the results are fed back through NHS Test and Trace. And the same's true for the lateral flow sites. So when you turn up at a lateral flow site, you do your swab, you hand it to technician, you leave the site. And when the sample is read, that's inputted into a database which connects with the NHS, and the NHS give you your results. So they're responsible for that bit of the system. At the moment, for the PCR tests, the results are quite quick. I had to have one earlier in the week because I was having some health checks done. And I had the test at 4 o'clock in the evening. At 10 o'clock the next day, I got my result. And that was at the walkthrough site in Aston. So the turnaround's pretty fast now, which is quite different to where we were before. Sheikh Noor asked about, we were doing well in Birmingham. Where did we get it wrong? We haven't got it wrong. Actually, we're doing extremely well. It's just taking time. And the reason it takes time is the size of Birmingham. So if you look at how many cases we have in the last 7 days, for example, we've had about 4,000 cases. And that gives us a case rate of about 343. Now, in order for us to reduce that case rate by, say, 10, we're going to have to reduce the number of cases by about 1,000. Now, if I compare that with somewhere like Blackburn and Darwin, for example, that's got a similar case rate at the moment for us of 342, they only had 510 cases in the last week. So for them to reduce their case rate, they've only got to drop by about 10 or 20 cases. So the challenge for us in Birmingham is actually, in order for us to get a really big difference in our case rate, we've got to do even more, because we've really got to reduce by quite a large number. And that's why it's important that everyone plays their part. We can't solve this by everyone being perfect in Bawdley Heath and people in Oscott not. We can only solve this by the whole city working together and everyone working together to drive that down. The tiers will be reviewed every 14 days. So Deborah's right, the next review date is the 16th of December. And Carol, you know, you're asking about, are the stats so bad? As I said, I don't think the stats are that bad. You know, what we've seen in Birmingham is we've been going up, but at a much, much slower rate than you would have expected. So if you look at what Birmingham's done, we've kind of gone up as a slow hill, and places like Manchester just went as a vertical climb. Now, the challenge for us is coming back down again. Places like Liverpool, who went into really hard restrictions about 6 weeks ago, have only just in the last 2 weeks really started to come down. And Liverpool's a big city. So I wouldn't have expected us to come plummeting down yet. We're starting to come down, and I really hope it's going to continue, but we've got to keep at it, because to turn the whole of Birmingham, we've got to bring those case numbers down by thousands of people, not just by 10 or 20. And that's why it's a bigger challenge for us. Mandy asked about traveling to a wedding. So no, I'm afraid I wouldn't consider traveling to a wedding unless you're the bride or groom to be essential. So there's an exemption for travel. So in tier 3, you're advised not to travel outside of a tier 3 area unless it's for work or education or health. Obviously, there's an exemption for that week of Christmas. So I'm afraid if you're just going as a normal wedding guest, I wouldn't consider that essential wedding, essential travel. So I'm afraid that's a no. I think there is a chance, Deborah saying, yeah, you know, if we stay in tier 3 and we do it well, there is a chance we could get down to tier 2 for the 16th. I think it is a bit of a long shot, but, you know, it depends a bit over how the data goes over the next couple of days, and it is looking really promising. The key bit, though, is getting that over 60 case rate down. And when I look at the numbers, the majority of those over 60s are not in care homes. It's actually about spread in the household. And that's where the germdefense.org website is really important to help us get that out and really encourage people to think about what can you do at home to protect mum and dad or granny and granddad if they live with you, because that's quite an important bit. Jane asked about the quality of the swab and the false negative rate. Yeah, so that's a really good point, Jane. The issue isn't so much the swab itself. The issue for lateral flow is the kind of using of the kit. And that's one of the reasons at the moment you can't use lateral flow at home unsupervised unless you're a clinical member of staff. So if you're a doctor or a nurse, you know, then yes, I mean, I'm a doctor, I can manage this bit of kit. You know, it's not super complicated, but it is a bit more complicated than, say, a pregnancy test. So that's what they showed in Liverpool, because they did try this in Liverpool, and they showed that if people don't do it and they're not supervised, then it doesn't work very well. So on the lateral flow, there will be testing sites like there are for PCR. There'll be lots of information about how to use the swab properly. There will be people on site as well to talk you through it. And all of that's designed to try and make sure it's accurate. Lateral flow has a very low false negative. It's got a slightly higher false positive in areas where COVID's not very common. So if you went and did lateral flow, say...
Does he do it one way than the other?
So I think someone's unmuted at the moment. There you go. So I think if you did lateral flow down in Cornwall at the moment, it's got a very low rate, you might get a lot of false positives. People who test positive with lateral flow are asked to then book a PCR test to confirm it. And that's just a confirmatory test, but it is quite important as well. So I answered about Liverpool. Okay. So Stephen asked about a staff member who'd had COVID, being cleared to return to work. So they'd obviously had their 10 days of having COVID, and then a member of the household also being diagnosed. And what else could they do? So if they're coming into work, because they're allowed to, they've had their 10 days of isolation. If other people in the house then develop COVID, it doesn't stop the first person going back to work. But it is really important to remember to reinforce hand washing, keeping that social distance at work, all the things that you should do to stop the spread of the virus apply. So those are the kind of things that are really important. It's also worth saying, you know, if you've had COVID and you're isolating for those 10 days, the 10 days is a guide. If you still have a temperature on day 10, you still need to isolate until you've had at least 48 hours, so 2 full days with no temperature. And that's because the temperature is our body's way of telling us we're still having a battle. So that's why there's a slight difference. You might have to stay at home longer if you've got a temperature. So in terms of visiting to hospital, Rebecca asked a question about that. Hospital visiting is being decided by each NHS trust. And that depends not so much about the tiers, to be honest, it's more about what's going on in the hospital. So you'll need to check with your with the hospital. My advice though would be, if it's not essential, i.e. you don't need to do it in the next 2 weeks after we start the restrictions, don't do it. And I wouldn't necessarily, you know, unless it's a close family member, so someone you're immediately related to, say your father or mother, your husband, wife, or your son or daughter, then I'm afraid I would suggest you visit by phone or WhatsApp or video, but rather than go in person, because you don't want to expose them, and you're in a tier 3 area, which means you've got higher rates than a tier 2. Dan asked about how effective the vaccine is. All of the vaccines at the moment show that with 2 doses, over 90% of people get a decent antibody response. But you do need the 2 doses, and they're all pretty consistent on the 2 doses. Some of them may be slightly different for different age groups, and that's part of what the regulator's looking at. Susan asked about time when staff and parents mix in a day nursery. Yeah, it's a really important point actually about, you know, nursery schools are really good at managing children when they're in class. But one of the risks we do see is when parents come to pick them up and everyone stands around at the school gates and you haven't seen people for a while and you stop and have a natter, and that's a risk. So, you know, that's one of the things to try and avoid. You can do it by staggering drop off and pick up times helps. Those kind of things are quite important. At the moment, there isn't testing for teachers or for nursery staff. I think probably the other side of the new year, we will see more testing available for education settings, but we'll see. Alison asked about supported living guidelines and care home guidance. So I think there isn't, at the moment, the rapid testing for care home visiting is not extended to extra care visiting, I'm afraid. It is something that we've raised nationally through our chains, and we will continue to. We've got to keep in mind there is only a fixed number of the lateral test kits at the moment. There's more coming. So I would expect that we won't see lateral flow for things like visiting someone in extra care and supporting living until well into the new year, I'm afraid. So someone asked about, will there be any difference in different areas of the city? Graham asked this for different tiers. No, government is absolutely clear. The lowest unit that they're considering for tier restrictions is a local authority boundary. They've looked at this also, interestingly, they did look at it in the shires about whether district councils should be considered differently, and they made the decision not to in the West Midlands, that the county council was the boundary. But certainly they're very clear with us that for the unitary authority, so Birmingham, Solihull, Sandwell, Wolverhampton, there is no appetite, and it doesn't make sense actually when you look at the data. areas like Northfield are stuck at the moment. They're not coming down, they're just stuck. There are very few areas in the city that have really shown that they've got more than a week going down and then they get stuck again. So we really need to see the whole city going down. That being said, we've also seen there's only 1 or 2 areas that have gone up in the last fortnight. And in both the 2 areas that have gone up, there are outbreaks going on. I know exactly what's happening, and there's a reason for it. So it's not about the community. Generally, everywhere is just getting flat at the moment rather than coming down particularly. So question, Andrea asked about travel. Yeah, interesting question. So at the moment, the travel corridors keep changing, and I'm afraid you just have to keep looking on the national website to find out whether you have to isolate or not. I do think probably in the new year, we'll see more of the lateral flow being rolled out to people who are isolating, and that might be able to shorten isolation. And we'll see more testing at the airports, a bit like you see in some of the other countries. So for example, in Iceland, which I was able to visit back in the summer, you arrive at the airport and you have to queue up and you do a PCR test at the airport. So you're swabbed at the airport and you're charged for it. I paid, I think, about 60 or 70 quid to have it done. And then you get a result within about 12 to 14 hours. And if that result's positive, then you have to go and present yourself to an isolation hotel. It's a bit risky, obviously, because you could, you know, get on a plane, feel fine, and then test positive and spend your entire holiday in an isolation hotel. But I think we will see models like that starting to open up more about that. Vaccination, information on the content of the vaccine. There is some stuff out there already, and I will get with Holly May tomorrow, we'll have a look and send the link round about that. And we've talked about tier 3 should be reviewed 14 days after it starts, so on the 16th of December. Tristan asks about R numbers. We don't calculate the R number at local authority level. We don't really do it at a regional level much because it's not particularly accurate the smaller your numbers are. But we will see, I think, generally what we're seeing nationally is that the R is now hovering just above 1, and we really need it down to well below 1 to really be confident that the NHS can cope over the winter. And that's why we've got so much of the country in tier 3 as well. Dan asked about Yorkshire. I'm sorry, Dan, I'm not up to date with what's going on in Yorkshire, so I can't really comment on that part of the country. Steve asked about long COVID. Yeah, long COVID is there's a lot going on long COVID. What I would say is if you do think you've got a long COVID, do talk to your GP, because in Birmingham there are treatment pathways, care pathways that have been set up. It's a relatively small number of people that end up with long COVID, but you know, there is care out there. Richard asked about places of worship. So communal worship, but bubbles can't mix. So that's no different from where we were a couple of months ago. So it means social distancing between bubbles in worship. So there are 2 ways you can do this as a faith setting. You can either say everyone's 2 meters apart, or you could say if you're coming to worship as a family that live together, you can be together, and then the next family's 2 meters apart. It's up to different faith settings how they run it. Outdoor walking, football, there's specific guidance, Tanya, on the website about outdoor sports at the moment, so do have a look at that, because at tier 3 there are some restrictions. Susan asked about, is it safe to go to the hospital for non-COVID? Yes, definitely. Particularly talk to your hospital. So different hospital sites are being managed differently. So University Hospital, for example, they've tried to put as much as possible into the Solihull site, because none of the COVID patients are put there. The COVID patients are predominantly looked after at the QE and at Heartland. So they have thought about this. And, you know, as Mandy says, they are doing a lot to keep this safe. Steve asked about childcare. It's the same as it was before we came in around the bubbles. And the childcare bubbles. So that's one of the things where it's been moved forward. So that's good. I think just picking up any last couple of ones, there are some app ones which I'll leave. Do I think we'll go into lockdown again after Christmas? I think it depends a little bit. I think we probably will see one more period of national lockdown before this is over, to be honest. I think that's just the reality of the way this will go, but we'll see. Catherine asked about after the 2 doses, would we test antibodies? I don't think they will, to be honest, but that's part of what the trial's been looking at. So that'll be in the detail of the trial data, and it's what the regulator will look at. Are there groups that what we would consider poor responders where you do need to test an antibody for that? Councillor Mahmood asked about, since we went in with the Black Country, are we going to come out with the Black Country? So they have been quite clear with us that individual authorities are being considered individually. They've been grouped at this stage, but that doesn't mean we stay in the group. So if Birmingham continues to come down and let's say Dudley continues to go up, then we won't necessarily be kept in the same stage as Dudley. So that will change. Fred asked about people concerned about issues in the longer term about the vaccine. Well, let's just be really clear. Vaccine is the second best buy in public health. Best buy is clean water and toilets, second, and hand washing. Second best buy, vaccination. You know, we eradicated smallpox in this country through vaccination and polio. We've saved people from going deaf from rubella. We've saved people from dying from mumps and being seriously scarred for life and disabled from measles. So vaccines we use every day safely, and very, very few people have any serious reactions to them at all. So, you know, there are always going to be people that we just can't persuade, but the reality is that we're very good at doing this, and we've done it a lot. We can. Ali asked about, is it a good idea to self-isolate before Christmas if you're going to meet up? I think it's certainly worth thinking about. If you can do it, and you really want to see particularly elderly relatives and the most vulnerable, then I think it's certainly worth thinking about, because you'll really reduce the risk to them. And I think that's what we've got to keep in mind. It's the risk to them that's most important. I think the community support, Alicia asks, there is an exemption for support groups similar to what we were before. So it's very similar for support groups to what we were in tier 2 before, but do look on the web page for that. There's plenty of information, Jez, for businesses on how to be COVID safe. We're getting the whistleblowing information through, so we do some spot checks on that, but it's ultimately up to employers in the same way health and safety is. You know, we don't go around and check whether an employer's got a fire hydrant, an extinguisher. You know, they are adults, they've got to take responsibility for it. And unfortunately, with over 9,000 businesses in the city, we can't just go and spot check everyone, but it is important. I think I've covered quite a lot of that. In terms of information, last couple of ones coming through, information for people who don't speak English. We are working to translate the guidelines as fast as we can. It does take a couple of days, but also our community partners are helping with this. And after this, I'm going on to a Q&A with our Chinese community simultaneously. I think it's in Mandarin and Cantonese. So I'm doing a very similar Q&A with them, but it is being translated. And that's just one of the ways that we try and do to help get information out. So I think I've covered just about everything that I can. Libraries, we're still waiting for information on that, Sandra. I don't think they'll be open for browsing and sitting around, to be honest, but we're trying to get a bit of clarity for that. The guidelines for weddings and funerals was the same as it was for tier 2, just as we were coming into it, is what I've read so far. So it looks very similar for that. And there is, you know, the really important thing is to limit the number of people you're mixing with, because that is the challenge. COVID is most likely to spread between people that know each other. You are most likely to catch it from people you know, and you're most likely to give it to people you know. And it's the actions we all take every day to reduce that transmission risk that protects the people we love. What government says is helpful, it's really important information, but it's the decisions that you all take, that I take, that we take every day that is fundamentally saving lives across the city, keeping the NHS going and protecting the people we love. So I'll leave it there, and it's great to see so many of you on the call tonight, and I'm sure I'll be speaking to you again in a couple of weeks. So back to you, Holly May.
Thank you. You answered so many questions so quickly. Thank you very much. I won't take up more of your time. We've already gone slightly over. Thank you so much for sticking with us with the technical issues at the beginning. Like we always do, we will send out this webinar in an email to you all. I just want to sort of quickly go back to Susan's question around translated information for people who don't perhaps speak English as a first language. We have some really good resources now on the Birmingham Public Health website. So I'll make sure that we pop a link in that email as well.
Holly, can I just add in that as well, that the app is available as well in 12 languages, and so all of the guidelines that are coming through in terms of local risk level will also be translated via the app.
Can I just a word of caution regarding translations? Is that many translations aren't targeted in a plain and simple way, and the literacy rate amongst communities, which are, for example, we have a literacy rate in UK and the literacy overseas is a lot different. So you need to have plain, simple English, plain, simple translations. Some of the Arabic translations I've seen, they seem to be like, coming from another world. Okay, they're very, very archaic and very, very high Arabic. So I think you need to have a process in place to check that it's plain and simple in the languages coming.
That is really useful information. If you don't mind, do you perhaps mind popping your email in the chat, and it'd be great to speak to you perhaps tomorrow if you're free.
Okay.
That'd be wonderful.
Just once, I'll do it now. Okay.
Thank you all very much for joining. Like I said, I won't take up any more of your time. If you do have any questions, please email the COVID-19 email. And yeah, that's great. Thank you so much. Have a good evening all.
Thank you.
Thank you. Bye-bye. Thank you.
Thank you. Bye.
Thank you. Bye. Useful. Thank you.
Have a good evening. Take